Hi guys. So, I wanted to kind of give an update on my appointment that was today, while it's still all fresh in my mind. I'm having a hemiplegic attack right now, which is why my one side of my face is drooping and I can't really hold up my neck. And it's kind of difficult to breathe and catch my breath. But, I'm going to do my best to just push through and let you guys know how it went. So, it did go well overall. The car ride was a bit rough, but it wasn't bad. And, basically the takeaway was I am not using my meds to the extent that I should. I've been underutilizing them, which I try to be super cautious and not use my as needed meds very often, but he said where I am right now pain wise is not where I should be, so I need to utilize my meds more, but still in a moderate, everything in moderation, not going overboard, but using them to a point where it does make an impact, because we can't really tell if the meds are going to make an impact or not if I'm not taking them as often as I should when I need them. So that was kind of shocking. And then we talked about doing ketamine, but he said he really doesn't want to do ketamine infusions for me, just because that's more nerve pain treatment that he's seen improvement with, and mine's more muscle dysfunction and spasms and stuff like that. So that really wasn't an option from what he can see at this point. And then we also we talked about doing Topamax to see if that might help with some of the nerve pain that I am having, but he's kind of hesitant to do that, so we're going to try a little, small dosage and see how I do with that. So that's another option. He said that my inner thigh pain is, that could help with that. And if it doesn't, or if the side effects are too much, we can do a nerve block. But he's really hesitant to do that as well. He wants me to do some aquatic therapy, physical therapy, aquatic physical therapy, and I've done that in the past for my fibromyalgia, but not specifically for my pelvic and lower back pain and stuff like that. So he says he wants me to try that first and use my meds and see where we go from there, if it gets better, if it gets worse, etc. So I'm going to be talking to my local physician here, because he wants me to see if I can be transferred to my primary care here, so I don't have to go there since it is expensive. So we're going to try that first for a while. He said if it does get really bad within the next 30 days, obviously to go back. So I think it went pretty well overall. I guess I kind of was more interested in the ketamine infusion thing, but if he doesn't think that that's not a good option, I trust him that that's not what we need to do right now. So I may bring it up later and ask my PCP about it, but I also don't want to push the envelope if it's not something that's going to do more harm than good, or not even make a big impact and spend all that money. I asked him about CBD, and he said that it's kind of a hit or miss thing, and that depending on where you go, if it's not distilled correctly, it might not be able to have an effective result as if it was state derived. So I'm going to do some more digging into that and keep you posted on where we're going, and like what I'm thinking about doing, and what I'll try and see what works and what doesn't. Because I am interested in doing this. It does look like going back to Chicago for DHE and that type of treatment is needed. He said it doesn't look like my meds are causing rebound migraines, which is what I was worried about, but that it's just that issue on its own, which definitely kind of gives me the heads up that I definitely need to take care of this, and that would be more on my neurologist department. It's just a lot to get there, so and I prefer to take Ollie with me, and he's not at that training point where he could go with me. So I don't know, we'll have to weigh our options and see. But summary, it went well. Wasn't any like big changes or whatever that like there's this one miracle cure and it's gonna fix you, like as I was, I guess, I don't know if I was hoping for or what, but just utilizing my meds correctly and then trying to integrate this aquatic therapy, which is going to be difficult since I can't drive, and I'll have to find somebody who's willing to take me because he wants me to do it at least like 3 times a week. But we'll see. Anyway, I just wanted to give you guys a quick update, and I'll try to keep you all posted on my CBD journey and what, if anything, is effective for me and might be effective for you, and I'll try to share that with you. And then keep you up with Ollie and then the aquatic therapy. So I hope you all stay chronically strong. Alright, bye guys.